A normal, healthy heart automatically regulates its own heart rate. Unfortunately, some hearts beat too slowly or in an irregular pattern. If you are diagnosed with this problem, your doctor may recommend a pacemaker to correct it. Traditional pacemakers require your doctor to make a surgical incision in the chest, where the device permanently sits in a pocket under the skin. The doctor then implants thin wires, which are called leads, from the pacemaker through the veins into your heart. These leads deliver electrical pulses that prompt your heart to beat at a normal rate. At St. Jude Medical, we invented the world's first pacemaker implanted in a human in 1958. Today, we continue to innovate heart rhythm management technologies to address patients' and doctors' needs. The St. Jude Medical NanoStim leadless pacemaker is a cylindrical device, smaller than a AAA battery, that senses and paces like a standard pacemaker. But unlike standard pacemakers, it resides entirely in the right ventricle of the heart. That means there are no leads, no chest incision, and no permanent pocket under the skin. To place this device, your doctor performs a minimally invasive procedure using X-ray images as a guide. A catheter that contains the pacemaker is passed through a small incision in the groin and threaded into the heart. The pacemaker is then secured to the wall of the right ventricle, tested and programmed to each patient's unique needs. If necessary, it can be repositioned or even removed at a later time. Since 1958, St. Jude Medical has been a leading innovator in cardiac pacing. Today, we are proud to offer patients another option with the NanoStim leadless pacemaker.